So the next here we have 36 and the question number 36, 45-year-old homeless man with history of type 1 diabetes mellitus presents to the emergency department with 1 day history of vomiting and abdominal pain. So one day history of vomiting and abdominal pain. He reports that he ran out of insulin and 3 days ago and couldn't offered to buy more insulin. So his heart rate is 104, so he's tachycardic. Respiratory rate 22, mildly tachypneic. Blood pressure 100/60, hypotensive. Temperature 36.9. So it is normal temperature or normal temperature. So on examination, he is dehydrated. So here we have dehydration and abdomen is non-tender. Blood results show pH 7.32. So here we have acidosis. 7.32, it's acidosis. And glucose 29, it is hyperglycemia. So here we have hyperglycemic state. And bicarbonate of 16, so we have metabolic acidosis. So here we have metabolic acidosis and we have hyperglycemia. And the patient, he has type 1 diabetes mellitus and presented with vomiting and abdominal pain and signs of dehydration. So we have to think straight away about a differential of hyperglycemic state in diabetes mellitus patient. Differential of hyperglycemic state in diabetes mellitus patient, it is either it's going to be DKA, diabetic ketoacidosis, or it's going to be HHS, hyperglycemic hyperosmolar state. Usually in DM type 1, the DK, it's the most common hyperglycemic state seen in diabetes mellitus type 1, and HHS is the most common hyperglycemic state seen in DM type 2, diabetes mellitus type 2. Which one of the following treatment, he's asking about the treatment, is fundamental to treating this patient presentation? So here, so he is not mentioning about the ketones, but this patient most likely, and with this part of the history that the patient is not taking insulin in the last 3 days, most likely the patient has DKA. So which one of the following treatment is fundamental in treating this patient? 1 liter of 5% dextrose intravenously. Usually we are not starting with 5% dextrose. Usually we are starting with normal saline. NaCl 0.9% is not 5% dextrose. Glucagon 1 milligram intramuscularly. Glucagon usually it's given for hypoglycemia. It's usually given for hypoglycemia. It's not given for hyperglycemia. So glucagon here it's wrong. Intravenous bicarbonate. This is wrong. Why? Because the patient has no so usually the indication for bicarbonate in the treatment of diabetic ketoacidosis if the pH below 7.1, and you might find in other references they might mention it is below 7, or if we have arrhythmia with a DKA, so we have to consider bicarb. So this is usually the indication for bicarb. Or sometimes if we have refractory hyperkalemia with diabetic ketoacidosis, sometimes we have to consider bicarb. So giving bicarb here, it is not fundamental. He's asking about fundamental. Intravenous bicarbonate is not a fundamental. It depends on the situation. In this situation, I think it's wrong to give bicarbonate. Intravenous insulin infusion, this is fundamental. This is fundamental. Intravenous insulin infusion. Metformin, this is there is no role of oral antihyperglycemic agent in the treatment DKA. So here the fundamental one, it is intravenous insulin infusion. The question number 37, 30-year-old woman present with hypothyroidism. So hypothyroidism confirmed with thyroid function test. You started here on levothyroxine 100 microgram daily. What is the most appropriate time to repeat her thyroid function blood test to see whether to adjust her dose of levothyroxine? Usually you have to wait until 4 half-life of levothyroxine. The half-life of levothyroxine is 1 week. It's 1 week. It's 5 days. It's 5 days up to 7 days. 5 to 7 days. 5 to 7 days. This is the half-life of levothyroxine. So you have to wait at least 4 to 5 half-lives. 4 to 5 half-life. So you have so you have it's reasonable to repeat the test after passing of 4 to 5 half-life. So the most appropriate it is after 6 weeks. So it is 6 weeks. After 6 weeks, you have to repeat the thyroid function test to check and to check the response for the treatment. And if you would like to do any adjustment, you have to do thyroid function test before doing this adjustment. So question 38, 20-year-old man presented to the clinic with 6-month history of blood-stained diarrhea. So here we have chronic bloody diarrhea and weight loss. We have weight loss. Appearance of the colonoscopy show cobblestone appearance, and there is a granuloma noted in the histology. This is very typical for inflammatory bowel disease, Crohn's disease. So which of the following most likely knows it's a Crohn's disease? This is keywords here. We have chronic diarrhea, bloody diarrhea, and weight loss, and cobblestone appearance, and granuloma. All of these are keywords for Crohn's disease. So question 39, an 82-year-old man present with a productive cough and high temperature. So here we have productive cough, chief complaint associated with high temperature for 3 days, acute onset of productive cough and high temperature, blood pressure 95 or 74, so hypotension, heart rate 112, so tachycardia, temperature 38.7, so we have low-grade temperature, respiratory rate 25, moderate tachypnea, saturation 92 in room air, so here we have hypoxemia. Chest X-ray confirmed community-acquired pneumonia. So we have CAP, community-acquired pneumonia. You admit him to high dependence care unit, to HDU. Which of the following not a part of sepsis 6? We have sepsis and septic shock campaign. They put criteria or steps for management of the sepsis and septic shock. One of these steps, it is first hour bundle. It's called first hour 6 bundle. This first hour 6 bundle, there's 6 things it has to be done in the first hour of any suspected patient with sepsis or septic shock. These 3 things you have to give and 3 things you have to take from the patient. So which of the following is not a component of these sepsis 6? Administer of antibiotic is one of these sepsis 6, and this antibiotic should be broad spectrum most likely and according to the local hospital guideline, and it's intravenously. Blood and urine culture, to send blood and urine culture, this is absolutely right. So it's 3 things you have to give to your patient. This is antibiotic and oxygen and fluid challenge, intravenous fluid challenge, and 3 things to take from your patient. So you have to take, you have to measure blood lactate or serum lactate, and if the serum lactate is higher than 2 millimole, you have to follow up, or you have to repeat the serum lactate after the start of the management, after a few hours of the start of the IV fluid and giving antibiotic. The other things, you have to take the routine blood test and relevant culture according to the suspected site of the infection. And the third thing to take, it is you have to take and measure the urine output. So isolation room is not a component of the sepsis 6 1 hour bundle. Monitor urine output, this is one of the components, and serum lactate measurement, this is one of the components. So here the choice C, this is the most, I think, the correct answer for this question. The last question in this MCQs paper, 30-year-old woman present with mass in her right breast. So here we have mass in the right breast. So she is 30 years old, young lady. Clinical examination reveal smooth mobile, so it is smooth and it is mobile, highly mobile, 3 centimeter mass in the right upper outer quadrant. These characteristics, this indicates a benign component or benign type of the breast mass. Most likely it is fibroadenoma. Which of the following is the most appropriate next investigation? To do CT thorax? I don't think it is the right thing to do CT thorax here, because given the age of the patient, given the characteristic of the breast mass, it's unlikely to be malignant. So I think it's no point to do CT thorax. Mammogram, if we are suspecting of breast cancer, but the age of the patient and characteristic of this breast mass, it's unlikely to be breast cancer. So mammogram, I don't think this is the right thing to do. MRI of the breast as well, I don't think it's the right thing to do. PET, PET CT scan or ultrasound of the breast. I think the right thing to do is ultrasound of the breast. And according to the ultrasound finding, either we might do intervention, ultrasound guided, or sometimes like fine needle aspirin cytology, or sometimes we are doing follow-up surveillance by ultrasound to check the size of this mass in the following 3 to 6 months. So I think the most appropriate here to do it's ultrasound of the breast. And this is the last, I think, the last question in this MCQs paper. So I would like to hear from you your feedback, and I hope all of this discussion and all of this explanation are helpful for your preparation toward your exam. All of these videos and the previous videos, and I will do more other videos for preparation to your OSCE exam and short answer question. I'm going to upload them into the teachable.com, and I'll put the link in the description to this video. Thanks for watching and joining us, and hope you the best toward your final exam. Thank you very much.